The AMA is working hard to enforce legislative solutions that direct more funding and resources to support the mental health needs of physicians. Like Dr. Adrian Ambrose, who starting from a young age helped people understand their minds. It all started with his mom and her own struggles with her health. Now, his work is dedicated to connecting and healing the minds of his patients and fellow doctors. This is Dr. Ambrose.
I wondered how different the world would be if we focused more on the similarities that we all have and less on the divisive nature of what makes us different. Aloha, Sydney. My name is Dr. Ambrose.
Nice to meet you.
Nice to meet you. Thank you for coming in. My name is Adrian Ambrose. I'm a child adolescent psychiatrist, and I'm a clinical interventionalist. So I'm currently the medical director in the Department of Psychiatry at Columbia University. I focus on treatment-resistant depression as a cluster of condition. The other layer of medicine is a personal story. My mom, unfortunately, had just multiple bouts of cancer and struggling with mental health challenges. She never let that stop her. I saw all the barriers that she had to break through in order for her to get care. Like she didn't really have any wherewithals to understand how to navigate the healthcare system. When I was in medical school, one of the things that I've learned about was healthcare access. Unfortunately, a lot of times patients can't afford the medication that we prescribe, can't even access the level of treatment that we recommend. So how do we bridge that gap? These kind of conversations, I think, are really uncomfortable for a lot of people because in healthcare, we are used to operating in this little box in which we dole out the treatment and then we kind of like hands off. And I think what my upbringing and my experiences have really taught me is that's not where you hand off. That's when you need to be hands-on and really connect with the patient and family. For my own journey, struggling with depression, it really forced me to confront a lot of barriers and make sense of all of those suffering and allow me to cultivate a sense of resilience for myself. And then I can use that knowledge to help someone else. One of the ways in which the American Medical Association can really leverage its size and its weight is through its advocacy work. One of the things that I'm really grateful for the AMA is the organization's ability to allow me to connect with other physicians who share common interests. At the end of the day, I think we all just want to feel like we belong. The one caveat that my mom always tells me is make the world a little bit better than before you came into it. That's the running mantra that I've been carrying in my heart as I navigate this life and this career in medicine.